Joining me is Democratic Senator from Massachusetts, Ed Markey. It's good to see you, Senator. You heard your colleague, Bernie Sanders, there mention the Help Committee, which you sit on. Is Susan Menares potentially your first call after this so she can respond to what we heard from the Secretary today? Should she testify?
100%. I'm the Health Subcommittee Chair on the Help Committee, and without question, we know why Ms. Menares resigned. She resigned because she was not willing to rubber stamp decisions that were made about vaccines by the anti-vaccination panel that has been created by Robert F. Kennedy in substitution for the experts that had had the job for generations. We know why she was forced to resign, because she was not going to bend the knee to these anti-vaxxers led by Robert F. Kennedy Jr., who are spreading misinformation across our country. In fact, misinformation is right now spreading faster than measles in state after state across our nation, and it's only going to absolutely accelerate as each week and month goes by this winter.
So you did just call for RFK Jr. to resign. Of course, Congress cannot compel directly a cabinet member to step down. So do you have any options?
We just have to keep the pressure on this administration. We have to be the counter to the misinformation which is being spread. When he was asked today how many people died from COVID, the Secretary of HHS said he did not know. How, in September of 2025, does he not know that 1.2 million Americans died? He also said he doesn't know how effective the COVID vaccine is. He's the Secretary of HHS. He's fired the people at HHS, at CDC and other agencies who disagree with him on the science, because he's bringing in the quackery, the traveling medicine show view of all of these diseases and vaccines and what they do for generations to help to protect Americans. 18% of all children under the age of 5 in the United States died by the age of 5 in 1900. What changed that? It was vaccines. It was other public health interventions that transformed the lives of people in our country, especially children. And right now, the Robert F. Kennedy philosophy has spread to Florida, and it's going to begin to infect state after state in the Sun Belt, in the red states, and then because of travel, because of transportation, they're going to be bringing those diseases to the blue states as well. So we have a public health catastrophe in the making in our nation. People are going to get sick. People are going to die because of the misinformation of Robert F. Kennedy Jr.
I want to make sure that I understand what you're saying, because catastrophe is a big word, and people dying, saying people will die as a result of this, is a big word, a big statement. How bad do you think this is? Really kind of put it in perspective for us. And does it feel like, other than putting pressure on, there's little that a member of Congress can do, even a U.S. senator?
If kids are not vaccinated for measles, for mumps, for rubella, it's inevitable that many of them are going to get sick, and many of them are going to die. But the same thing is true for other diseases and the vaccines that are related to them, including the COVID vaccine for this coming winter's version of COVID. If people are given misinformation by this administration, by Donald Trump, people will not get the vaccination, they will get sick, they will die. And so that is the truth. That is why so many of the former CDC heads wrote that op-ed in the New York Times. They're warning about the healthcare catastrophe, the tsunami of disease which will be hitting our country because of the denialism of Robert F. Kennedy Jr., empowered by Donald Trump, and all advanced by this anti-vax movement that Robert F. Kennedy, for all intents and purposes, led in our country for the last 2 decades, and now he's the head of all vaccinations in our country, and he's telling people they don't have to get them.
And the net result of this is that states are trying to take some action themselves. We know, we heard about it even today at the hearing, California, Washington, Oregon coming together. They want to take the lead in some research, take the lead in giving what they believe is sound, scientifically based advice to the people who live in their states. Massachusetts, I understand, working to organize your own vaccine policy coalition. I wonder what states leaders in your state are talking to. And is this where we are? Is this where we are, that the federal government gets pushed aside, and depending on where you live, you might be able to get science-based information from your leaders?
Yeah, Governor Healy has made it very clear that she is not going to abide by the standards set by Robert F. Kennedy Jr. She's going to impanel a group of experts. And by the way, Massachusetts is the healthcare capital, not just of the United States, but of the world. And Massachusetts will set its own standard. And they'll make sure that as a result, that people who need vaccinations have access to the vaccinations. People who need access to health care will get access to it. And as, I hate to say it, as hospitals shut down, as medical clinics shut down, we will make sure that people get access to the health care they need. We won't allow these drastic cuts in Medicaid, drastic cuts in the Affordable Care Act to undermine the access to health care, which everyone as a human right is entitled to.
Senator Ed Markey, thank you.